Hello, this is Robin Dennison. We're continuing with Module 11. This is the second part now, and the focus of this particular second part is avoiding common errors in terms of item writing. The first point is about what we'll call mom and apple pie keys, and that is when you have options that draw students to them, and that is test-wise students are going to be drawn to items like within legal guidelines, according to established safety procedures, using appropriate hand washing techniques, any of those things where you say, oh yeah, got to do that, absolutely. So you want to avoid phrases like that that just give away the answer. In this next question, I'd like for you to take a minute and look at it and see what you think is clearly the most obvious answer. You can stop again the recording if you choose. So as you look at this one, you can realize that, wow, to ensure client safety. Anytime you say client safety, that's going to be the cue that, wow, got to take that one. Couldn't possibly choose anything but that. The next common error is backing the wrong horse, and that is that you certainly need to make sure that your key is the right answer and that there is clearly a single correct right answer. That you shouldn't have any legitimate argument for another one of the options or against your correct answer. So make sure the key is universally accepted, not just how we do it here. And of course, it's always a good idea to have a specific reference. So you might want to have the page number in their textbook, for instance. The way that teachers deal with item challenges varies. A lot of faculty members will ask the student to submit their point in writing and have at least 2 references to support their point. Obviously, what you don't want to do is to encourage people to argue every single question, and you want questions that are clearly defensible. So the next question is an example of that point of backing the wrong horse. So take a minute and read this practice question. So as you read that practice question, you can notice that the choice between A and B is really tough. And that is that you say, well, yeah, positive homons. I know all about positive homons. We do know, of course, that it's one of those kind of controversial issues these days in terms of the validity of and reliability of homon sign. So some people might choose A, and then again, some people may choose B. So that's a situation where you kind of have 2 sort of right answers, and you don't want that. The next point is trivial pursuit. And this is something that really bothers me, is when people put items on tests that are really trivia. You need to decide what is a need to know, and those need to knows should be on your exam, not the, wow, isn't that interesting sort of item. So there are a limited number of items on the test, and you really want to devote those items to things that you think are crucially important. The next question is an example of trivial pursuit. And as you look at that question, take a minute and look at that question. Well, is that really something you want to waste a question on, that particular question? And I find this question quite interesting too, because it says, which of the following findings would the nurse expect to find? If the nurse can actually see that cobblestone appearance of the intestinal mucosa, I'd like to hear about that. Or if she can see those outpouchings in the mucosa and so on. The answer to this one is the cobblestone effect. But again, that's endoscopy, and that's certainly not something the nurse can expect to find unless they're doing endoscopy. And again, is that something that's so important that you think that there needs to be a question on that item, on that particular aspect? The next point is don't preach and don't teach. That's not the purpose of an exam. And so sometimes teachers will like put extra verbiage in there to actually teach during the test, and that's not what a test is for. It is to differentiate, right? It's to discriminate. So preaching and teaching just adds to the reading comprehension, and again, it's distracting. So you're really writing your items to assess knowledge, not to entertain, and not to preach, not to teach. So if we look at that next question, and you can stop again if you want. You notice the phrase, in addition to changes in body image in your STEM. Well, that's like teaching them that there are changes in body image with scoliosis. And the fact that you have that there is a clue, of course, that's going to lead a test-wise student to come up with B. Next point is avoid controversy in anything that is controversial on the exam. It's kind of like, the Hohmann sign before. Also, you don't want to include things that are sensitive on the test. They're great for discussion in class, but they're not things that are appropriate for testing. Also, things that are culturally or politically touchy, you don't want on a test. Next point is, are you looking at reading comprehension, or are you looking at nursing content? And so you need to make sure that, again, it's succinct, it's tight. They only have to read what they need to answer the question. So avoid unnecessary verbiage. Definition questions is the next point. And keep in mind that really, unless you're in those very early semesters, really maybe early semester, if you have a fundamentals course, or maybe you even have a course on terminology, some programs do these days, then those are appropriate questions for those courses. But it's not appropriate for when you get into their third or fourth semester. So if you look at this definition question, the first one there, you can tell it's a really easy question. If 100% of them don't get that right, then they don't know what hypo means. So that's not a good question. That's not going to differentiate for you. On the other hand, in the next question, what you see is, number one, the student has to know that a potassium of 3.2 is low, and then they also have to know the manifestations of hypokalemia. So that is much more of an application level question than a pure definition question. Next point is to be clear and brief in the STEM. And again, your STEM should be longer than your options, but it shouldn't be unnecessarily long. Avoid excessive verbiage there. The difficulty of the item shouldn't be in the STEM. It should be obviously in the options. And then the next point too is write at the appropriate level. Remember, these are nursing students. These are not critical care nurses going for certification exams. The reading level should be about 8th, 10th grade level when you're talking about undergraduates in terms of their comprehension level. But in terms of content, it should be at that generalist level for undergraduates. Next point is write plausible distractors. And I have several points about writing plausible distractors as we go through. First of all, every wrong answer should fool about 3% of the students. And distractors distractors should only fool the students who don't know the content, obviously. They shouldn't fool the students who do know the content, or it's poorly written. So they do need to be plausible. The next point is, as you write the item, consider what you know about the misconceptions of your students, because those are the perfect distractors. Where you know how students get confused about certain points. Those are the ways that you should write your distractors. Use terminology that they've heard but they may not be real sure about. And also have your options, your distractors, sound friendly and positive. Because if you have them sounding negative, it's a dead giveaway that they're the and especially if it's a negatively stated, then certainly that's the one you don't want. But all those options should sound friendly and positive to make them more plausible. They're less plausible if they're negative. Right. Still with writing plausible distractors, think like a weak student when you write. Make sure there's a good reason a weak student would pick each distractor. And then remember that we're talking about students, so they know something. It's not like they don't know any terminology or anything like that. But you have to think about what their common misconceptions are. And none of them should be throwaways where you just, gosh, I can't think of anything else. Let me just write something that I know no one will pick, but at least it'll make D, right? I'll get a D in. So the next question that you see there is an example when we think about writing plausible distractors. So take a minute and look at that question. So when you analyze this item, this is a great question because all four of those options are very plausible. The student who really knows will be able to pick out the correct answer, but those are all quite plausible. Notice that the options are parallel. They're about the same length. They're written in the same form. The stem is brief and to the point, but again, it's still longer than your options. Some finer points to item writing as we continue with this, and that is strive for symmetry in those four options like that last question had. They really should look very similar. Avoid mutually exclusive items. So if one item includes the other item, like it's a subgroup of that item, then that won't work because, again, students are going to say, well, they couldn't both be true. Avoid absolute terminology. Always, never. Avoid the same or similar language in the stem or the key. That's always a clue. And then also, you don't introduce new information in your stem because, again, that can't, they have to be looking at the stem and say yes or no according to the stem, not information that's in the question. Next is write options that are independent, not inclusive of another. Avoid creating subsets. We'll talk about that. Don't use all of the above or none of the above. Avoid negatively worded stems, and also avoid options with multiple elements or partially correct answers. Options should be parallel in length and form, and also all four options should be either independent or in pairs. So for instance, if I had an answer A is this. Let me give you an example. Answer A is pear. Answer B is pear and apple. Answer C is grapes. And answer D is grapes and bananas, right? So what you see there is I had two that were one answers and I had two that were two answers. They should all be one answers, or they should all be two answers, or, phrases. So when you look at symmetry in this next one, and you have to think like students think, and that is they're looking for the one that's different from the others. So pulmonary edema, cardiac tamponade, tracheal collapse, and pneumothorax. The only one of those, when we look at the test, the item analysis, the only one of those that is not two words is D. And that's okay if D is a distractor. But if D is the right answer, then you sort of gave them the right answer by the way that it's phrased. Next example of symmetry in the four options as you look at that list, notice that you have two of them that relate to WBCs. And so you have one where it's above 3 and another where it's below 9. Most of the time, students are going to say, well, it's A or D. Which is it? When you think about the item analysis, the test-wise student is going to know that it's A or D because, again, they're kind of opposites. It's one or the other. The next example of symmetry in the 4 options is when you look at these 4, and what you see is you have some decreased levels and some increased levels. So when we look at item analysis, you say, that's good. You have 2 elevated and 2 decreased. What you don't want is to have 3 elevated and 1 decreased, or 3 decreased and 1 elevated, because again, it makes it more likely it's the outlier. Next point is to avoid mutually exclusive options. And that is that when you look at this particular list where you see B and D, and let's say this is a question about a chord transection, right? And so they know that there's paralysis below the level of the injury, and now they just need to decide, is it flaccid or spastic? They can just almost eliminate A and C, because again, it has to be one or the other. I know they're paralyzed. Is it flaccid? Is it spastic? There are only 2 types, flaccid or spastic. So when you look at the item analysis for that one, again, flaccid and spastic paralysis are mutually exclusive, so they're going to choose one of those 2. In this next crazy example, where we're not even using real words, you can pretty much pick out the right answer. And that is that, as you look at these, what do you think? Take a minute. And so in the item analysis, you know that, B says always, right? And we know, of course, that rarely in life is anything always, never, none, or no. So the right answer is anything but always. So what you see is in A it says all, and in B it says always, and in D it says no. So certainly, as you look at it, C must be the right answer. Next point is to avoid the same or similar language in the stem and in the key. Students look for this. And so, for instance, when you look at this question, what you see is you have potassium level in the stem, and then you have potassium in option A. So in the item analysis, that would be fine if potassium were not the right answer, because it would lead people away from the right answer. But if it's the right answer, then that's, again, the test-wise students are going to jump right on that and know that answer. So the next fine point is not to introduce new information in the option. So read this one and see what you think. Again, stop the webcast if you need to. So when we analyze that particular item, the test-wise students are going to eliminate D because there isn't anything in the stem that says anything about afternoon napping. So it's like, it's like this extraneous information. You say, well, why would I think that? In the next example, we want to look at options that are independent. So for instance, if you look at the item analysis of this item, then you're going to say A and B are essentially the same, so it can't be both, so we need to go to one of the other 2. In avoiding the creation of subsets, when you look at these options, you'll notice that blood pressure and heart rate are both components of vital signs. Okay, but vital signs is more encompassing, and so a test-wise student is going to consider that, and they're going to choose the one that's more encompassing. So in the item analysis, since A contains B and C, the test-wise student is going to choose A. The next point is all of the above and none of the above. NCLEX no longer uses those, and you should no longer use those. They're dead giveaways, right? And anytime somebody says all of the above, you usually think that's the right answer. We don't like those. Next point is to avoid undirected stems. And what that means is when you look at this, the issue of student not knowing what they're being asked without reading the options. So it's, I know I've seen questions where like the stem is only 1 or 2 words, and then you have to get down to the answers to actually figure out what's being asked. So, for instance, in the examples that are on the slide, when a nurse is administering enteral feeding, she, what? And versus a nurse caring for a patient with an enteral feeding through an nasogastric tube, which of the following actions should the nurse take? And the other thing about having really short stems like that is it creates that issue of where you're testing multiple items again, because you can have like 4 options that are totally unrelated to anything. Another way that people do that, which I really don't like, is they will say, which of the following statements is incorrect? And then they'll have 4 totally unrelated statements. So again, what is it? It's quadruple jeopardy. That's 4 questions in one. And if you were going to use those, you should give the student credit for A, B, C, and D, because they answered true, false, true, false, true, false to each one of those. Next point is negatively stated stems, and which of the following are not, and which of the following are contraindicated. Contraindicated can be used sparingly, but in general you should avoid negatively stated questions. NCLEX again doesn't accept these anymore, and we really shouldn't be using them. What happens so often is students miss the negative word, and they miss the question because they miss the negative word. So a little checklist again for review of what we've talked about already. Is the key the only defensible answer? Does the stem clearly express the question you're asking? Is the item written at appropriate level, which means student, whatever level student you have, or new graduate, if you're testing in an orientation program? Are all the destructors plausible without being too close? And again, can you expect about 30 to 90% of the students to get that item correct? So we've talked about multiple issues that are good and bad, and mostly bad. That's what we focused on, and how to avoid those in writing items. But we also talked about things that do help in terms of creating better differentiation.